Hello guys, in this video we are going to study about heart block ECGs, right? You have to learn to understand or learn to identify which type of heart block it is, and it is a very important topic as far as ECG is concerned, and you can expect a question from it every alternate year, I should say, right? So heart blocks are very important and you should know how to identify them, and it is extremely easy once you know it. It is not a tough task, it is an extremely easy task. So first of all, coming to a normal ECG graph, this as you can see over here is a normal ECG graph. This is P wave, this is Q, R, S and T wave, right? This particular area is called PR interval, right? PR interval. So we are going to study in the basis of this. Then from here another ECG wave starts, again P, Q, R, S and T wave, right? So this is a normal ECG graph. So what happens in first degree heart block? What happens in first degree heart block? In first degree heart block, you have to remember that the PR interval is prolonged and it is not progressive. What does it mean? It means that the PR interval is a bit longer than the PR interval of a normal human being, but it is not lengthening as the next heartbeat proceeds, right? For example, how can I explain it? This is a PR interval and it will be like this. Now normal PR interval should be like this, right? It should be this much, but in this case it is this much. So it will be like this: P, QRS and T. There will be another ECG wave will be coming, again P, again QRS and T, right? So you can see over here the PR interval is long but same, right? It is long but same. It is not increasing, okay? So it is not progressive and it is prolonged. So that's important. It is called first degree heart block. It is a very benign type of disease. What will happen if the PR interval is increased? If the PR interval is increased, then nothing much will happen. Only the filling time of the ventricle will increase and end diastolic volume will be increased. That's it. Nothing much more than that, right? Now coming to second degree heart block. In second degree heart block, what will happen? In second degree heart block, there is two types: Mobitz type 1 and Mobitz type 2 right? So what are the differences between the two? First of all, what happens in Mobitz type 1? In Mobitz type 1, PR is prolonged. Again PR is prolonged, just as we saw in first degree heart block. In second degree Mobitz type 1, there is also again prolonged PR interval, but it is progressive. Which means that the PR interval keeps on increasing with the next heartbeat, right? Also, another very important thing, there is a missed QRS after some time. We see the ECG of it, Mobitz type 1. This is P, QRS and T, right? Now next ECG is starting. Next ECG, P, a bit longer QRS and then T. Now again I'm going to the next ECG. P, much more longer QRS and then T, right? So here you can see the PR interval over here and here is keeping on increasing, right? It is increasing. The PR interval is increasing, and one time after that, what will happen? If I continue the ECG over here I'm continuing the ECG, then what will happen? Next ECG will start like this, right? The next ECG will start like this, P, and there will be nothing after that. No QRS, right? No QRS, right? Which means ventricular contraction is not present. Why does this happen? That after a certain point of time, there is no QRS, or if QRS is absent, means no ventricular systole. Why there is no ventricular systole? It is actually very easy to understand. That, for example, if we increase the PR interval, what is actually PR interval denotes? PR interval denotes AV nodal delay, right? PR interval denotes AV nodal delay. For example, if the PR interval is increasing, as it is seen in Mobitz type 1 heart block, PR interval is increasing. One time will come after which the PR interval length is so much that another SA node firing has come to the AV node, and that particular firing will generate a ventricular systole, right? Means that after a certain point of time, the PR interval is so much increased that it doesn't have much time to stimulate the ventricular systole, and in that time another SA node sends another signal to AV node, right? So after one P wave, there is one missed QRS in the ECG, right? This is Mobitz type 2, my type 1. Now coming to Mobitz type 2, it is also very easy. What happens in Mobitz type 2? Very easy. PR interval is normal, right? PR interval is normal, but missed QRS is present. Missed QRS is present, which means that as we saw in Mobitz type 1, that the ECG, that the PR interval was actually increasing, and then one time came when there was so much increased PR interval that it didn't generate a QRS complex, right? But in Mobitz type 2, there is no PR interval change, and you will get a missed QRS even without a missed increased PR interval. So that's why it is interesting, right? P QRS T. Next ECG, P QRS T. Next ECG, P QRS T. Till now you are seeing that PR interval is same. It is not increasing, neither the PR interval is progressive, neither increasing. But now suddenly P and nothing is there. No QRS. No QRS. So this is how you will understand that it is a Mobitz type 2 heart block. Right. Now coming to type 3 heart block. Type 3 heart block. Type 3 heart block is easiest to identify. Right, why? Because there is no P wave and QRS complex rhythm, right? Means atria and ventricle will beat independently, which means that the atrial contraction actually produces P wave, we all know, and ventricular contraction actually produces QRS complex, we all know that. Now since atrial contraction is preceded by the ventricular contraction, now what will happen, that if the atrial contraction or ventricular contraction are not rhythmically arranged, means after P wave QRS is not coming, but in case with QRS is also coming, then a P is coming, then QRS is coming, then again a QRS is coming, and after that it is coincided with the P wave. Haphazardly anything is happening, right? This actually happens in a third degree heart block. So what type of graph will you see? You will see a very haphazard graph. You won't be able to understand. This is P wave, for example, P wave. Now it again a P wave. There is no QRS after that. Again a P wave. Now after a P wave, there is a QRS complex, right? There is a QRS complex and the T wave. Then again just after T wave, very shortly we get a P wave, and again we get a P wave. Right, then after that we get a QRS complex, okay, and with that QRS complex we get a QRS complex. This is QRS, and with that QRS there is a supersided P wave also. With that QRS, there is a supersided Q wave, P wave also, right? Just after that QRS, a P wave also came with it, without a T wave. Then after that T wave is happening, right? This is how a type 3 heart block you will see, right? Where will you see? Very important. You will see type 3 heart block in Lyme's disease. Extremely important. You cannot afford to forget it. So this is as easy as this. Although I am unable to show you some questions about it. I was thinking to show you some questions, but I actually not having any questions related to this topic because my Marrow subscription is expired. That's why. But you open your Marrow module or question module and start solving it. You will easily understand how heart block ECGs are done. It is extremely easy, right? So we see over here, we see this ECG, right? PR interval, right? Also, is there any QRS absent? The answer is no. There is no QRS that is missing. And PR interval we see is not progressive, but it is prolonged. Normal PR interval is not so long. So what it will be? It will be first degree heart block. Then second degree Mobitz type 1, Venkatesh. Right, what I said in second degree type 1 Mobitz type 1 heart block, there will be PR interval will be prolonged. It will go on prolonging, it will increase until a QRS is absent. Right, देखो, this one increased, then or ज़्यादा increased, then more increased, then what happened? QRS absent. Right, again the same cycle will repeat. Right, so this is type 1. Next, coming to type 2. What did I say about type 2? In type 2 there is again QRS absent. QRS will be absent, but PR interval will not go on increasing. So what happened in Mobitz type 1? So see, PR interval same, PR interval same, PR interval same, PR interval same, but still QRS is gone. That means Mobitz type 2. Lastly, T supersided with P, right? QRS happening with P anything is happening, everything is chaos. Third degree heart block, most important, Lyme's disease, right? So that's it, guys. I hope you understand this topic, and it is a very important topic for you to understand. You cannot afford to make mistakes in it. Very easy. People just get feared of this topic for no good reason. Thank you.